So, good morning, everybody. My name is Kelly Grindrod. I'm a pharmacy professor at the University of Waterloo School of Pharmacy. I've been doing a lot of presentations to help people get comfortable with the vaccine, ask questions about the vaccine. If you're just not sure about something, I'm here just to give you answers that you've been having a hard time finding. I do a lot of these presentations and I hear so many different questions. Ask me anything. Any question is okay to ask me. I'll tell you as best as I can what I know right now about the vaccine. I am also a pharmacist and I also am a vaccinator. So I work, today I will go to the Health Sciences Campus Clinic, the vaccine clinic on Victoria and King. And I also prepare the doses, and some days I give the vaccine as well. So I talk to a lot of people who come in getting the vaccine about reasons they're getting vaccinated, reasons that they maybe waited because they weren't sure, and what actually made them come in. So again, any questions, I'm happy to answer. I know that you are learning English. Many of you are learning English through this program. Last year, I lived in Quebec City and I was learning French. And I will try to speak slow because I remember how hard it was when someone speaks too fast and you're trying to learn. So again, if I say something and you miss it and you want to ask at the end, that's okay. I will repeat it. I will say it again. That's totally okay. So these slides, this presentation is part of a group called 19 to 0. And 19 to 0 are doctors, pharmacists, and nurses who are all working like me to help people learn about the vaccine, make sense of the vaccine, decide if they want the vaccine, and to feel okay about the vaccine. So these slides are up to date as of today, May 19th. But as many of you know, COVID changes so fast, the news changes so fast. So we're always updating these as well. You can go to the website, you can go to the pharmacy website. I will give you a link after. I will also share a link on vaccine information, or maybe Fazia can, vaccine information in other languages as well, in your own language perhaps. Okay, so there's three things we want to do this morning. Understand how the mRNA and viral vector vaccines work. There's two kinds of vaccines. There's 4 vaccines in Canada, 2 kinds of vaccines in Canada. We'll talk about both. We're going to review the COVID vaccines, how effective they are, and we're also going to review the safety, the side effects of the vaccinations. So as many of you know, we are in the middle of a third wave. So right now, we are close to the right here. A lot of a virus. Ontario is getting better. Ontario's numbers are coming down a bit. That's good. That's partially vaccine. The vaccines are helping to bring that down, and the lockdown. Other provinces, Alberta, Manitoba, they're really struggling with numbers going up. But Ontario right now is starting to come down, which is a good thing. So what do we have to do for the vaccination? So if you look at this table, we have 37.6 million Canadians. So about 38 million Canadians, or people in Canada right now. About 29 million are willing to get vaccinated right away. Right now, these are the people who are already registered, who are just waiting. They either have been given the vaccine or they are waiting for their appointment. So most Canadians are ready to be vaccinated right away. We need, for the community to be protected, we need about 30 million Canadians to be vaccinated. So that means we have 1 million Canadians that we need to have that we need to be vaccinated who aren't ready yet. And that's the group that needs the most help. So if we're looking at how many Canadians have already been vaccinated, I update this slide maybe once a week, once every 2 weeks. The numbers are growing like crazy. There's so much vaccine in Canada right now. It's wonderful. So I just checked this morning and, oh, I should have updated this, or I updated it on the right. In Canada right now, there are 19 million doses that have been given. And as you can see on the map, in most provinces, about 40% of people have gotten one dose of the vaccine. And the news this morning was actually that Canada is going to have more people with the first dose of the vaccine than the US sometime in June, I believe. So we are actually potentially going to even get ahead of the US in terms of protection. But for a lot of people who don't have the vaccine yet, they're not sure. And that's totally normal. It's totally normal to not be sure. It's totally normal to have questions about the vaccine that you want answered before you're willing to get vaccinated. It's totally normal. When I'm vaccinating people, so many people are coming in right now and they're saying, I haven't had a vaccination in 10 years. I haven't had a vaccination in 30 years, but I'm here for this. And often for people, it's because they talk to their family doctor, they talk to a pharmacist, their rest of their family got the vaccine and it was okay. And they said, okay, I saw people around me get the vaccine. It was okay. I can do this too. So it's totally normal to have concerns. A lot of the concerns we hear is that I'm not going to get COVID. The risk is low. A lot of people say that. But we also hear in the hospitals from the doctors who are treating people with COVID, people are also saying, I can't believe I got COVID. How did I get COVID? I didn't think I could get COVID. So the longer that the pandemic lasts, and if you haven't gotten COVID, it starts to feel like, well, I'm not going to get it. But a lot of people are still getting COVID. There is the belief too that the vaccine was rushed. So I'm going to talk to you a bit about how that was done. And it wasn't rushed, but why it was faster than normal. I'm going to talk to you about long-term data. So people say they want to wait for long-term safety data. So I'll tell you what we're actually waiting for and what we're not waiting for, and vaccine safety and effectiveness. Let's start with the mRNA vaccines. So the mRNA vaccine is like a most wanted poster that tells your body how to recognize COVID-19. It can't and won't change your DNA. mRNA vaccines are Pfizer and Moderna. Here's how they work. For Pfizer or Moderna, when the vaccine goes into your body, it injects mRNA, messenger RNA. It's a special kind of component in your body that your body uses to make proteins. Your body is full of mRNA. If you've eaten a steak, you've eaten mRNA. This is a normal part of bodies that bodies use to make protein. It does not change your DNA. It cannot change your DNA. So your cells read the mRNA and they start building the same kind of spike protein COVID-19 has. But these spike proteins are harmless. It just shows your body some instructions. Your body makes some up. It says, oh, that's what it looks like. I'll remember that. And then it gets rid of it. mRNA is very fragile. So that's why we freeze it in very cold freezers. That's why we have to be careful when we transport it, because it's very fragile. And so the research in the last 10 years was to have how do you get the mRNA into someone's body so it can help the body make proteins like the spike protein? They actually started the research for these vaccines in the 1970s. I think it was 1979. And a lot of the research in the last 10 years was, okay, now we know we can use mRNA, but it's so fragile. How do we actually use it and keep it safe in a vaccine? So what they did was they wrap the mRNA in a fatty layer of protection, almost like a helmet. It protects the mRNA so it can get into your body. As soon as your body uses it to make the COVID protein, the mRNA dissolves and goes away. For 3, your immune system sees the spike protein your body has made and starts building a defense and launches an attack. This is when you might feel some tiredness, some fatigue. You might feel tired, aches, or fever. It's your immune system learning. And number 4, now that your body can recognize the COVID-19 spike protein, it can fight COVID effectively. You are building immunity. So the most important thing to note here is that the vaccine is not the virus. The vaccine it teaches your body to recognize a small piece from the surface, from the top of the virus. That's it. There's no virus in the vaccine. It's just your body making some spike protein to learn to recognize it. There are 2 mRNA vaccines in Canada. They're like twins. They're pretty much the same. There's Pfizer and there's Moderna. Pfizer is the vaccine from Germany. It was developed in Germany. Moderna is the vaccine developed in the United States. Otherwise, they're the same. We think of them as being pretty much the same. Both of these vaccines have 2 doses, 0 and 21 days for Pfizer, 0 and 28 days for Moderna. Pfizer, as you'll probably heard in the news, is now approved for people 12 years of age and older. Moderna is also doing the research on 12 and older, and we expect it will be given to kids soon. Both are also studying children 6 months old to 11, and we expect the vaccines to be available to younger kids probably in August or September, so later in the summer. So a big question here is, in Canada, you get 1 dose, and then we're waiting 4 months for the second dose. Is that okay? So the thing to know here is the reason the companies chose 0 and 21 days or 0 and 28 days is because that was the fastest way to get the trials done. Usually, when you have 2 doses for a vaccine, you have 1 dose, and then 3 to 6 months later, you have a second dose. If it's too close together, it might not work as well, but too far apart isn't usually a problem. And actually, having a second dose later usually helps the vaccine work better. And there's been some research that came out that's been starting to come out in the UK, in Scotland, and Britain, suggesting that even with these vaccines, it might be even better when you wait 3 months or more for the second dose. So Canada is doing 0 and 4 months. The reason was we could vaccinate way more Canadians with 1 dose and get much better protection. But it also is very possible it might even be better anyway to hold that second dose for 3 or 4 months. So Canada is learning. For Canada, we're in a good place where we have good research. Where this experience will be very good is if any of you come from India, for example, Brazil. There's such bad virus. A lot of countries around the world are dealing with this. Canada is asking a question. If you delay the second dose and you vaccinate more people with 1 dose, is it okay? And we're really hoping the Canadian experience, the Canadian research, will be useful for all these other countries around the world as well, who may also want or need to do the same thing. Give one dose to as many people as possible and then start second doses. So how effective are these vaccinations? Well, Pfizer was studied in the trials in 40,000 people, and Moderna was studied in 30,000 people. The trials showed that about 100% all people are protected from severe illness, hospitalization, and death. That's great. All 4 vaccines in Canada do that. Great. Pfizer and Moderna also protect 95% of people from any COVID infection at all. So if you have 100 people who are vaccinated and exposed to COVID, 95 would not get COVID, only 5 would get COVID, and those 5 would only get mild to moderate COVID. No one would get severe COVID or be hospitalized or die. That is in the trials what the clinical trials told us about the vaccines. And they work across races, ethnicities, and ages. So that's the trials, but the vaccines have also been given to millions and millions and millions of people around the world. And so we want to know, is it the same in the real world? Is it also this effective? So here's a study from Israel. 2 groups of people, 600,000 in one group who got the vaccine, and then 600,000 people who hadn't yet got the vaccine, who were waiting for the vaccine. Here's what they found, and this is helpful. After dose 1, 2 to 3 weeks after dose 1, about half of people, 46% and 57%, are protected against getting COVID. 74% are protected against getting COVID and ending up hospitalized, 62% of getting severe COVID, and 72% protected from death. So even one dose 2 to 3 weeks later, already a lot of people are protected. If you wait 3 to 4 weeks after dose 1, so dose 1 month later, you see the numbers go up even more. About 80% of people are now protected for severe illness, hospitalization, and death. When you give dose 2, 1 week after dose 2, the numbers go up to almost 90%. So you can see 1 dose gives really good protection, 2 doses gives great protection. But you have to wait a couple of weeks, up to 4 weeks after the first dose and 1 to 2 weeks after the second dose. What about allergies? So allergy rates are higher with the mRNA vaccines. We knew that early on when people were being vaccinated back in December and January, but we are used to managing anaphylactic allergies, the swelling of the mouth and the throat and the tongue, like peanut allergies, like seafood allergies. Some people, to drugs, they have these same kind of allergies. What we do is if you have ever had an anaphylactic allergy, that swelling of the lips and tongue and mouth and throat, to anything, like a food, a drug, we may ask you to wait for 30 minutes after the vaccination to make sure you're okay. Everybody has to wait 15 minutes. Everybody, no allergies, wait 15 minutes. But if you have a history of having this kind of a bad reaction, especially to a vaccine or a drug, we ask you to wait 30 minutes just to be safe. If it's a food, if it's something like that, we say maybe you want to wait 30 minutes. So if you have a history of allergy, just tell the people when you are getting your vaccine, and they'll help you decide if you want to wait for 30 minutes after, just to make sure it's okay. So let's move to the viral vector vaccines. The viral vector vaccines use a safe virus to carry some of the genes of the COVID virus, the SARS-CoV-2 virus, to teach the body how to recognize it. The viral vector vaccines are Astrazeneca and Johnson & Johnson. So how do they work? So number one, scientists make harmless adenoviruses that deliver a short genetic code to your cells. Your body destroys the adenovirus after. Number two, the genetic code tells your cells to build the same kind of spike protein COVID-19 has. This can't change your DNA. So number two here is very similar to the other vaccines as well. Both kinds of vaccines are teaching your body how to make the COVID-19 spike protein. No, neither vaccine has COVID in it, just instructions on making the spike protein. But what is an adenovirus? So if scientists use a harmless adenovirus, what is an adenovirus? So an adenovirus commonly causes colds and other mild symptoms. Certain adenoviruses were chosen for this vaccine delivery job because they are modified or changed so that they can't infect humans. Your body sees the new spike protein and starts building a defense and launches an attack. You may feel fatigue, aches, or a fever at this point. It's your immune system learning. And if you got AstraZeneca, a lot of people after their first dose felt their immune system learning. Fatigue, they felt tired, ache, and maybe a bit of a fever, a headache. That's your immune system recognizing the spike protein and memorizing or remembering it. Number five, your body can now recognize the COVID-19 spike protein and fight off COVID-19 effectively. You're building immunity. So there's two viral vector vaccines approved in Canada, AstraZeneca, which has been in the news a lot lately, and Johnson & Johnson, which we have Johnson & Johnson in Canada, but we haven't started using it yet. We got the doses from the United States, and Health Canada is working to approve the factory that made it, but that hasn't happened yet. So we have Johnson & Johnson, but we haven't used it in Canada yet. We had a lot of AstraZeneca that we used, but as you know, it's been in the news, and I will talk about that. AstraZeneca is 2 doses. It works best when dose 1 is given, and then at least 12 weeks later, at least 3 months later, the second dose is given. AstraZeneca works better when those 2 doses are further apart. And so we're working in Canada right now. People who got AstraZeneca in March at a pharmacy won't be due for their second dose until more the end of the month, end of May, and into June. So AstraZeneca and Johnson & Johnson are both approved for 18 and older, but in Canada, in Ontario, we only use AstraZeneca for people 40 and older. And the group, the National Advisory Committee on Immunization, or NACI, had said you could use it for 30 and over if you wanted, but what they said is it's preferred to give the other vaccines because they're safer, but if needed, you could use this in 30 and older. And I will talk a bit more about what that means. So how effective are they? Well, the most important thing to know is these 2 vaccines also protect against severe illness, hospitalization, and death. And actually, these are the numbers in the clinical trials. But when we look at the vaccines in more of a real world scenario, they're approaching closer to 100% protection against severe illness, hospitalization, and death. They also protect against any disease. So like the mRNA vaccines were 95% effective, and these ones are closer to 60% effective. What that refers to, what that effective means, is if 100 people got AstraZeneca and are exposed to COVID and would normally have gotten COVID, up to 80%, 80 of them will not get COVID, and 20 to 30% might get mild cold symptoms, mild to moderate cold symptoms. But we know that this vaccine also protects people against being contagious. So this is actually, both of these are actually very, very good vaccines because they protect against severe illness, hospitalization, and death. They're not as good at protecting against mild to moderate cold symptoms, but when you're in a third wave and people are dying, and you're in your workplace, or people in your house are going to the hospital because they're so sick, all that matters is severe illness, hospitalization, and death. So that's why about 6 to 8 weeks ago now, the Canadian government said, let's use Astrazeneca because the risk is so bad for COVID. We need to protect people against severe illness, hospitalization, and death. But then and we knew, and now we're talking more about this rare but serious side effect called vaccine-induced thrombotic thrombocytopenia, or VITT, VIT for short. It's very rare. So originally, they thought it was about 4 in a million people got it. Now they're realizing it's probably closer to about 1 in 60,000. Still very rare, very unexpected. So the comparison is with the AstraZeneca we used in Canada, we expect somewhere between 20 and 40 people to get VIT, to have this bad reaction. But every day in Canada, on many days, we're having 40 people die a day. So that's that risk benefit that they're weighing, that if it was a normal time and it wasn't COVID, maybe we wouldn't be so sure. But when COVID is so bad, the risk of COVID was so bad compared to the risk of this vaccine. If you're watching in the news right now, the United Kingdom, the UK, used a lot of AstraZeneca, and they're starting to open up businesses, having visits, things are getting much better. So AstraZeneca was a very, very good vaccine, but it has this rare but serious side effect. So some of these this is an unusual clotting condition where your body creates antibodies for your platelets. Again, it's very rare, but some of these abnormal clots resulted in, they're strange clots, they're weird clots. They'd be in the brain, in the abdomen, in the stomach, places like that. They're not regular clots. They happen 4 to 28 days after vaccination. So if you got AstraZeneca, look at your calendar and mark 28 days after your injection. After 28 days, we don't know of any cases of VIT that have occurred, and most of them occur closer to the beginning of that. It's only a handful that are going all the way out to 28 days. And again, this is different than regular blood clots. In Ontario at first, it was safer to get vaccinated with AstraZeneca than to stay unprotected. But Canada is now getting so many mRNA vaccines. We are getting so much Pfizer and Moderna coming in. And we even had an announcement yesterday of 9 million Pfizer doses in July. Huge, huge amounts of vaccine coming in. So in Ontario, the risk of COVID is also decreasing. So what Ontario has done is it has said, okay, we won't use AstraZeneca anymore for first doses. We will only use it for second doses. So if someone got dose 1 of AstraZeneca, they will be given the option, the choice, to have dose 2 of AstraZeneca. There's research going on right now to also study if you got dose 1 of AstraZeneca, can you have Pfizer as dose 2 or Moderna as dose 2? We actually think that might be very good. We actually think the combination of the two may offer even better protection than Pfizer, Moderna, or AstraZeneca. The early research is suggesting that people's immune systems have a stronger memory if they get that maybe AstraZeneca first and then Pfizer second. So it's good. So what my message or my point is, if you got AstraZeneca as your first dose, it was a good choice to make at the time. It was the right choice to make at the time. And if you need, when you want to get your second dose, you will probably be given a choice where you can choose to have a second dose that's AstraZeneca, or you can choose at that point probably to have Moderna or Pfizer instead if you'd rather have them. So Ontario is developing a strategy to give people choices. Still, though, AstraZeneca is a very good vaccine, especially in countries where there's a lot of COVID and no access to other vaccines. So Pfizer and Moderna are very fragile and they're very hard to send places that might not have the special freezers. AstraZeneca is very easy to work with, and we might find that it's a vaccine that needs to be sent to places that can to actually vaccinate people. So I want to give you an example of the harms and the benefits. So this was looking at when we looked in Ontario numbers, when our third wave was the worst, when our risk of COVID was the highest. So this is over 2 weeks. If you look on the left, if people got in these different age groups, got the AstraZeneca or Johnson & Johnson vaccine, for example, this is how many people would have avoided a hospital stay, that's the blue, or how many lives would have been saved, that's the black. On the right-hand side, you see the number of people who would have gotten, for the same number of those people vaccinated, the number of people who would have had this bad blood clot reaction with AstraZeneca or Johnson & Johnson. So you can see that when COVID is bad, the vaccine, even with the rare side effect, is still a very good choice because it saves more lives. When the risk of COVID goes down, the benefit isn't as good anymore. And here's how the 4 vaccines compare. So you've got AstraZeneca and Johnson & Johnson, both for 18 and older. AstraZeneca's 2 doses, Johnson & Johnson's 1. Across all of them, based on the research that we have right now, all appear to protect against severe illness, hospitalization, and death. Once you're fully vaccinated, those who are fully vaccinated who are still at risk of mild to moderate cold symptoms from COVID, AstraZeneca and Johnson & Johnson's 34 to 38, Pfizer and Moderna's only 5. All 4 offer some protection 4 to 6 weeks after just the first dose. And for the rare but serious side effects, you get the rare but serious vaccine side effects with blood clots with AstraZeneca. It's right now 1 in 60,000 is the number that we estimate. Johnson & Johnson, it's lower. The risk right now seems to be about 1 in 500,000, and that does seem to be holding. So we're keeping our eye on that to see the risk of this might be lower with Johnson & Johnson. With Pfizer and Moderna, there are no serious safety signals like this at all with these 2 vaccines so far. So people are watching Pfizer and Moderna very, very closely. The countries that identified the AstraZeneca side effect are also watching Pfizer and Moderna, and there are no serious safety signals coming up with Pfizer and Moderna. Pfizer and Moderna appear to be safe. So what is the effectiveness of just 1 dose of Pfizer or AstraZeneca? This is the study from Scotland. It looked at 5 million people who had gotten 1 dose, and they looked, and what they found was after 1 dose, you had your best protection against hospitalization at about 1 month, 4 to 5 weeks. For Pfizer, the effectiveness to protect against hospitalization was 85% with 1 dose, and with AstraZeneca, it was 94%. So who should not get one of these vaccines? Well, If you have an allergy to one of the ingredients in the vaccination, so in the Pfizer and Moderna, it's polyethylene glycol or polysorbate that you'll be asked about. It's very, very unusual for anybody to have an allergy to those ingredients. Those ingredients are in Advil, liquid gel caps, Benadryl products. It's a common ingredient and very, very rare for someone to be allergic to it. If you have an allergy, a known allergy, your doctor has confirmed you have an allergy to those ingredients, you would not get the vaccine with those ingredients. You could be offered a different vaccine. So ask your pharmacist or your doctor which vaccine you can get. If you have an allergy to some ingredient in a vaccine, ask them and they'll help you find a vaccine that's safe for you. If you have COVID or you think you have COVID, just wait until you're better and then get the vaccine. If you're sick, if you have an infection, a urinary tract infection, pneumonia, a skin infection, where you might need antibiotics for it, just wait until you're better and then get the vaccine. And if you got another vaccine in the last 2 weeks, like the shingles vaccine, pneumonia vaccine, tetanus vaccine, anything, just wait 2 weeks and then you can have the COVID vaccine. And that's just because we want to make sure if you have side effects, we know if your side effects came from the COVID vaccine and not some other vaccine that you got. What should I remember from the side effects of these vaccines? So 8 out of 10 people complain of a sore arm, but only 1 in 100 call that soreness severe. About 5 in 10 people complain of fatigue or tiredness and a headache, but only 1 in 10 need Advil or Tylenol. Now, I mentioned before, side effects are the result of an expected immune response to the vaccine, and most are mild and easily managed at home. When I am vaccinating people, I tell them, whatever you use for a headache at home, Tylenol, Advil, whatever, it's okay to use that if you get a sore arm or body aches or a headache from the vaccine. It's totally okay. How did the side effects compare across vaccines? Well, with Pfizer and Moderna, we think that it appears the side effects are worse after the second dose. So if you go and get your first dose of Pfizer or Moderna, you're probably going to have a sore arm the next day. So it's helpful if you can take the day off, or if you can take a Tylenol or an Advil, or if you have, say, Saturday, you're not working, maybe get the vaccine on Friday, for example. That's especially important, though, for your second dose. So when it comes time for your second dose, try to arrange your schedule so that you're not working the day after, that you already have a day off. That can be helpful. For Astrazeneca, the side effects are worse after the first dose. Interestingly, it's the opposite. So a lot of people felt just not great the day after they had the vaccine, but it goes away. So you might start feeling, for me, when I got my vaccine, my arm, so I got my vaccine in the morning and I felt fine. And that night I was really tired and I went to bed at 6 p.m. And the next day I felt fine, but my arm hurt a little bit. My husband went 2 days later, got his vaccine, came home. He went to bed at 7 p.m. The next day, his arm hurt. He didn't want to sleep on it, but a day later, it was fine. Another person I worked with got her first dose, and the next day had a bit of felt feverish, but went to bed early. By the day after, she was fine. That's pretty common. People might feel a little bit of something the next day, but usually with a good sleep, they feel better. It's more common for younger people to have side effects and possibly for women. So if you are younger, in your 20s, you might be more likely to have that sore arm, fatigue, headache. If you're older and maybe have children, maybe a 20-year-old son, you might have less side effects than your 20-year-old son, for example. But you can manage these with over-the-counter pain and fever medicines. So as your immune system learns from the COVID vaccine, you may have some fatigue, headache, achy muscles, chills, and a low fever. You're feeling slightly bad for a short time as you build immunity for a long time. So common questions that we get. How were the vaccines developed so fast? Well, the interesting thing about this research started 40 years ago. And it was very slow going. And the researchers who were trying to research these vaccines couldn't get money. No one took them seriously. They would get a little bit of money. They'd do a bit of research. They'd use that money, or they'd use that research to try and get a bit more money and do the next step. It would take years to get the money. They'd do a small bit of a trial, then they'd have to get more. It would take years. And they were trying to vaccinate when maybe there wasn't a lot of disease around. So if they were studying the vaccine for Ebola, for it could be rabies. There's lots of things that they've been looking at these vaccines for. Cancer was another one. And what they were finding is it was just slow and people weren't funding it. And then the pandemic hit and COVID hit. And all of a sudden, all the governments and all these governments in the world, all these huge drug companies all came forward and said, let's do this now. And they put so much money in. They were using private jets to fly vaccine from one country to another to start learning to build it. There was so much COVID in the world, especially remember in the United States when it was so bad last year, when they were running the clinical trials, people in the placebo group were getting exposed so fast that the trials were faster than they would normally be. No one cut corners. The research wasn't, the research, this is some of the best vaccine research that's ever been done. But there was so much money and so much partnership that this is how fast we could normally do research. So interestingly, we have made a huge leap in vaccine research in the last year. And those researchers who developed the COVID vaccines are now developing vaccines for, they've turned to cancer. So imagine a vaccine for cancer. So that they're studying that, rabies, Zika, HIV. So they're studying vaccines for HIV and AIDS using the mRNA and the viral vector vaccines. Ebola, they've been looking at, there's a vector vaccine for Ebola. Now they're looking at mRNA. So really, really incredible. This might also be the future of flu vaccines. Our flu vaccines are good, but they're not very effective. They're the best we've got. This might actually be a really good flu vaccine. So it's not that the vaccines were developed so fast, it's that vaccines and drug research could be this fast if we all work together and funded it this well. So I've already said that the vaccines do not change your DNA. The ingredients are safe. There are no blood products in the ingredients, no fetal cells, no pork, no beef, nothing like that. The vaccines are preservative free, meaning they have the mRNA, the fatty protection, and some sugars and salts and water. That's it. Nothing else. So there's no blood products, no fetal cells, no pork, nothing like that. And what kind of long-term data do we still need? We're not waiting for long-term safety data. What we're waiting for is to know, do I need a booster in 1 year? Do I need a booster in 5 years? A booster is an extra dose, another dose. How long does this vaccine protect me? How well does this vaccine protect me against variants? So current variants, the ones we know about, these vaccines work well. But as long as there's virus raging around the world, there will be new variants, and we have to keep checking. Does the vaccine still work against that variant? The other one that they're looking at is, does the vaccine protect you from being contagious? And just recently, research is coming out suggesting or showing that quite possibly, if you get the vaccine and you're exposed to the virus, as your body fights off the virus, it does protect you from being contagious. So if you work at a factory, for example, and pick up the virus at work and bring it home, the vaccine actually that you get will protect your family as well from the virus. So that's some long-term research we're waiting for. For the viral vector vaccines, it's all the same. No DNA is not affected. It was fast for those reasons. For this one, as you're learning, as we're all learning, we are learning with the viral vector vaccines about this rare but serious side effect. It's not a long-term side effect. So side effects for vaccines show up within 6 weeks. And this blood clot side effect with Astrazeneca does show up 4 to 28 days after the vaccination. So that's not long-term data. What that is as some with vaccines, we might need 1 million, 2 million, 3 million people to get the vaccine before we see some of these side effects emerge. That's why we're actually starting to feel really good about Pfizer and Moderna, because they've also been given around the world and we're not seeing those same side effects with those. So let's talk about vaccine confidence. In Canada in July, before vaccines were here, less than half of Canadians were willing to get the vaccine. And that number was low through the summer and into the fall. But around December, when we got our first doses of Pfizer in Canada, Canadians started to say, okay, maybe this is something I would get. When you asked me before about a vaccine, I'm not sure I'd get a vaccine. But when you're asking me now, and the vaccine you mean is this Pfizer vaccine, maybe I would get that. And what we're seeing is as more and more people get vaccinated now, more and more Canadians, more and more people in Canada are willing to get the vaccine. This changes. So in a workplace, for example, we might offer the vaccine and maybe 60% of people say yes and 40% say no. If we go back a little while later, more people say yes because they've seen people around them get it. They've seen that it was fine. They see that they were okay, and it builds confidence. So sometimes a lot of the people I'm vaccinating in the clinic are saying, I am the first person in my family to come in and get the vaccine. I'm getting it to show them it's okay. That's what we're starting to see in the surveys. So if you get the vaccine, be proud and make it public. People are likely to get the vaccine if their healthcare provider also got it, but we're also learning, this is a slide I made for healthcare providers, they're more likely to get it if their priest or minister or their their spiritual leader also got the vaccine, their mom, whoever it is in their community that leads their faith community. If those folks got it, they're also more likely, the people around them are more likely to get it, but also just people in families. If you get it in your family, you're an example to other people around you and you help build confidence for them too. So this is a very busy table just showing you all the vaccines that are being researched for COVID right now. So we've talked at the top about Moderna and Pfizer, lots of those in Canada, pretty much the same, excellent vaccines. You'll see a lot of those. We also have Johnson & Johnson and Astrazeneca in Canada, also excellent vaccines with this rare but serious side effect that we're learning about. But there's others. So there's Novavax, which we expect to come to Canada probably in the next year. It's a protein subunit. There's another German vaccine that's mRNA. The Russian vaccine is a viral vector vaccine. And then China has 2 inactivated virus vaccines. That's the more traditional, like the flu shots that we give.